Genetic information is now used routinely in patient care to diagnose conditions, to guide choice and dosage of medications, and to assess our response to therapies. It can allow at-risk individuals to take preventative steps to reduce their risk or, in some cases, avoid developing diseases altogether. It has potential to change all aspects of how we practice medicine, effectively, economically and compassionately, optimising prescribing, preventing side effects and facilitating early diagnosis. But we have to have the confidence to engage with genetic testing, to know that it won't cost us or our families the ability to insure ourselves either now or in the future. Over the past two generations, we have experienced an extraordinarily rapid evolution in the scope and the complexity of the genetic testing undertaken every day in the clinics and the hospitals of this country. We've adapted quickly, and we've been able to remain at the forefront of the uptake of this technology globally. The issue that we address today is that our life insurance industry can, though, at this point, legally use the results of genetic testing in a way which is actively discriminatory. Where people fear discrimination by insurers, they avoid genetic testing. This fear causes delays in diagnosis and in preventative and curative treatment. It has a significant negative impact on patient outcomes. My constituent in Kooyong, Professor Martin Delaticki, reported seeing this effect in the DNA screen study, an MRFF-funded population-level DNA screening pilot study testing young people for genetic risk factors for cancer and for heart disease. Despite having no family history of the disease, many young people declined to participate in that research once they discovered that its results could actually impact their ability to gain life insurance in the future. I myself was an investigator on a previous MRFF study which assessed the potential for ultra-rapid genomic testing for newborn babies with life-limiting rare diseases. The genetic counselling around that study, which was being provided to parents of babies who are critically ill, was more challenging because of the potential implications of those diagnoses, not just for the patients, not just for the parents, but also for other family members. Imagine trying to deal with that sort of discussion when you have a newborn baby in intensive care. In 2018, the Joint Parliamentary Committee's inquiry recommended consideration of a moratorium and further legislative action, limiting the use of predictive genetic information by the life insurance industry. In 2019, the Financial Services Council introduced a partial moratorium, restricting member life insurance companies from requiring applicants to disclose genetic testing results and from using those results for policies, but only below certain financial limits. This was an industry-regulated policy. It had no government oversight. It was plainly inadequate, and the degree at which it has been enforced is unclear. A recent federally funded study assessing the effectiveness of that moratorium, the Glimmer Project, found that fear of genetic discrimination is still deterring individuals from having genetic testing in this country. The easiest and the simplest way to address this issue is via an amendment to the Disability Discrimination Act 1992. This Act currently prohibits discrimination on grounds, including genetic status, but it provides an exemption for risk-weighted insurers under its Section 46. Amendments to remove that exception, as it applies to genetic results, would be a simple and effective way of achieving prohibition without requiring a whole new standalone act. And so I ask the Attorney-General to implement this important amendment, to build public trust in genetics and genomics and to support best practice medical care for all Australians. It is urgent that we do this now, when we're on the cusp of a time when DNA testing is becoming an intrinsic part of routine medical diagnosis and treatment. I call on the Albanese government to address and prevent genetic discrimination in life insurance in Australia. Doing so will right wrongs. It will remove injustice and assist all Australians to access the world standard life-saving medical care that our medical system wants to provide them and that Australians deserve. I commend the motion to the House.